It's a lovely day, isn't it? And we're going to talk about something that will benefit all of us, make the day even lovelier than ever. In Abuja, it rained a little bit, or it wasn't much. I'm not too sure. I was sleeping, so I can't really say. But I know that with the rains, all of us slept well. A lot of us would have gotten up and hit the medicine chest. We did not do that because we had a good sleep, and that's coming from nature, the weather. Now, have you ever heard that your life is in your hands? Yes, a lot of us literally interpret that as taking decisions, critical decisions about ourselves without letting the experts, play their role. Self-medication, that's my drift. And if you know what that means, it's a whole lot. Some people say it's suicidal. I don't know. But I know that within us today, a doctor is in house to tell us more. And of course, we're going to be sharing our stupid opinion from this side of the divide. And when we opened, you saw something pretty nice, and you're wondering what's going on. Happy birthday to you.
Thank you, thank you. I think this is the first time that my birthday will coincide with the show.
Okay.
So, yes. So,
and we
so
decided
much.
to ring the bell.
Yes.
And make the noise.
Yes.
Happy
Thank you
birthday.
so much. Thank you, Coach.
Okay.
Thank you, Joy, and thank you, my dear producer.
What did you do exceptional? Because you're looking extra nice.
Well, it's morning, so
you're looking extra nice.
I haven't done anything. Today. I'm not likely to do anything today, not because I'm not thankful. I am. Every day that one wakes up is a privilege.
Yeah.
But this birthday crept up on me. I literally did not remember that we had even entered April.
Wow.
Which is unlike me. But this time around, there's a project I'm working on, and it's just completely subsumed me. And I looked up and it was like 4 days to the birthday, and I was like, well, whatever. The important thing is I'm alive.
You're alive.
I'm well.
And you're giving thanks.
And you
so
look
that's
good.
it. Oh, thank you so much. Thank you.
I know that, Devon, your people won yesterday. And you're
Joy.
Joy.
sorry. It's Devon's day, so forgive me.
Wow.
Oh, are you Arsenal?
Yes.
I'm a Gunner fan. I've always been a Gunner fan. That's why I'm looking super bright today. So we hope when we get to Madrid.
Last week she was saying she's not happy they lost.
No, today
This
we
week
won.
you're super happy.
So we're expecting to have a win in Madrid and get to the next round.
Okay, that's a good one. Hello.
My sister, good morning. Oh. Good morning. Good morning.
All right, I know that a lot of us here are culprits. And if you say you're not, I'll say, look at the face of a liar. So have you ever done self-medication on your own?
How many times I think is a better question, which I can't count. I'm a typical Nigerian, to be honest. It's just now I'm receiving sense. But I think we're so used to it. We are so used to it. In fact, what's even worse, as parents, we even did it for our kids. Mm-hmm. That's the sad part of it, and I'm also guilty of that.
Okay,
Because,
you do your own and you also give
yes,
to
when your
children.
child has temperature, it's a bit high and he's not eating, it must be malaria. And then you go to the pharmacist. And to be honest, our pharmacists have turned to doctors.
Yes.
That's the truth. Because most times we go to the pharmacy, I don't necessarily self-medicate in the sense that I diagnose myself, but the pharmacists actually do the diagnosis for us most of the time. And now we've moved further. I don't know, is it that the hospital system is a problem? Because it's easier to walk into echo scan and just do a blood test and then carry the result to the pharmacy than to go to the hospital and stay on a queue for maybe 2 hours, and the day goes by. So I think I'm not making excuses. We are not supposed to self-medicate, and we are receiving sense, but we have moved a notch higher. We now go to echo scan and go and do scanning.
Okay.
Blood test.
You were talking, Devon was...
No, it's true. Yeah. It's true. I think
you're also a culprit?
Yes, and it's always with the malaria thing.
Yeah.
What bitter taste in my mouth, okay, warm to the touch, so I'm lethargic, aches, I'm not sleeping well. Malaria treatment. In fact, I know how I do it. I do the tablets first, then I follow it up with the injection after, and it works. Usually. I'm not recommending, please. I'm not recommending, but that's what I do, literally all the time. And after a few days, if I'm still not feeling too
Then you go to
good,
the hospital.
I do broad-based antibiotic, the entire
She's worse than us.
No, the thing is, sorry to interject. I had a doctor who was also a friend, not a friend in any sinister way. You know, these kinds of doctors that are very chatty. And he used to tell me, listen, because of certain issues, each time you treat malaria, you need to, you know, just do a broad-based antibiotic as well to clear out any bacterial infections that could be in your system. So this wasn't me just plucking it out of the sky. But the truth is that it's better to go to hospital, get properly tested and diagnosed, and then the doctor tell you what to do, rather than just running with. But I'm guilty. I'm guilty.
But you see, like you said something there, that you go to the hospital. But I've just realized all the hospital, all they tell you is malaria.
Yeah.
So sometimes you tend to wonder, this kind of malaria doesn't it good? Today they say it's 2+, tomorrow they say it's 3+. Mine, I'm not a malaria person. Everything, I put it down to menopause. If I have headache, I say it's menopause. If leg or something, everything is menopause.
Menopause has suffered.
And yeah, it has suffered, because you see, the thing here is, one, the doctors are a bit pricey. Most of the time you go to the hospital, the queue is so long. And I like to see a particular doctor who knows my history. So sometimes they now tell me the doctor is not there. I have to come another time. And maybe because I'm not too sick, I'm not patient enough to wait. So I'll just say, okay, let me go to the pharmacy, let me take this, let me take that. But the thing with me is that I'm not really into drugs. So I think I just let it be. I had a shoulder pain, and when I was telling some people, this one said arthritis, this one said maybe your sugar level is high, everybody was saying everything. And I was wondering, why are you telling people about what is wrong with you? You know, the best place for you to go is to go to your doctor.
Simple.
If you go to your doctor, he does the test and he tells you what's wrong with you. So I think maybe after this program, I will try and be a good girl.
Can I quickly add something, Elizabeth?
Let's touch base with doctor in the house. We have a doctor who is seated with us and he's listening to all that we're saying. If the director can connect us with the doctor, that would be very nice. If you can connect us with the doctor, let's say hello to him. Good morning, doctor. Can you hear me?
Yeah, good morning.
Okay. So we would like to have you introduce yourself first of all.
Well, my name is Dr. John Toa Gwidiam. I'm the founder and chief executive of In-Country Medicare. In-Country Medicare is an integrative and a holistic stroke regenerative, medicine, center. So that's what I do, and I've been doing this for over decades.
All right, so we'll get back
in Abuja.
We'll get back to have your opinion, on our talk, and of course your expert advice. We would like to go to the street and ask one or two persons questions. But before then, you had something you wanted to add to what I was saying.
Yeah, when Joy said something about when we go to the hospitals, most of the times, government hospitals in particular, and I'm not trying to call out the government hospitals, it's always malaria. And then I remember I had a discussion with a friend of mine who works with the lab.
You guys are forgetting to add the typhoid that comes with it.
And typhoid, thank you.
Typhoid, yes, I do.
And she said something to me that was, to be honest, it changed the trajectory of my thinking. She said, look, let me tell you something, Didi. Many times in the labs, they don't even do the test.
Is a lie.
That's crazy.
Believe me, and I'm saying this on air, she told me many times, because it's always usually malaria and typhoid, say they just write it.
God.
Oh my God, that's
so.
And then actually, I made a Facebook post about this. Was it last week or so? And somebody came for me. He was very upset. I said no. There was a time, inevitably, if you went to hospital and went to lab in Nigeria, you were going to be diagnosed with malaria, typhoid. Inevitably.
Yeah.
Not until I happened to go to a hospital one time where I guess the doctor was trying to be a bit more diligent than usual. And as we got talking, I told him I treated malaria. This was the 4th time I would be treating malaria. And he said, typhoid. And he said, sweetheart, if you've had malaria up to 3 times this year alone, you'd be dead.
Yes.
Typhoid.
Wow. Yes.
I know.
So,
Really?
and yes, I have
typhoid is that bad.
Yeah.
People should not joke with it.
Yeah, it
Don't
causes
tell
perforations in your intestine and things like that.
Every time you're going to tell you typhoid and malaria, it's not true.
My daughter, who is a doctor, said, listen, that typhoid, it's just a term we use to cover what could be any bacterial infection. It's not really typhoid. You just write it. And I'm like, wow.
Oh, see?
Okay, let's hit the street and find out, before we get back to the doctor, why most Nigerians, in fact, do I say all Nigerians? I don't know. But I'm also a culprit. I'll tell you my story when we return. But let's find out from Nigerians why they prefer to self-medicate.
I think the reason why Nigeria go to self-medication is based on two reasons. Number one is the accessibility to the healthcare centers, and number two is the affordabilities, the charges in some of the healthcare centers. So, in Nigeria, we face a lot of stresses here and there, up and down like that. So, for some of the Nigerian citizens to access where they can get this as to the hospital and all the sorts, so it can become so difficult at times.
Basically to save time, and then it costs less to self-medicate.
First of all, I would say is lack of information, and secondly is impecuniosity. What I mean by lack of information is that a whole lot of Nigerians don't know the risks involved in self-medicating. When I say impecuniosity, I mean financial incapacity. This reason is because a lot of people don't even have the finances to seek proper medical attention, which the doctor will refer them to go and get properly diagnosed in order to understand or know what exactly the ailment is.
The main reason why so many people, before now, so many people don't do self-medication, but because the cost of living is very high now, some would think of going to the lab, after the lab then going to go and buy drugs that is going to be too expensive. So some of them probably goes to go and buy drugs.
Actually, is because of the poverty. Because most of them, everybody knows it's good for him and for his health. But where you have no money, where you have lack of money, you can't afford the normal treatment at the hospital.
Because it's a better option now, because you used to be feeling the same sickness frequently. So when you feel the same that sickness, you have to go and buy medicine without going to look for the doctor or for doing tests and so on.
Going to the hospital is not even easy to start with. And when you go to the hospital, there's a lot of process before you can even see the doctor. And then poverty again is another cause for people to decide to self-medicate.
I think why Nigerians self-medicate, most of the times they always complain of funds and money. So that's why they don't always go to do proper medication or go for checkups in the hospital. They always tell you at times that before they go to the hospital, let them self-medicate and see if they don't get better, they can now rush to the hospital, and which is wrong. I believe it's wrong to always self-medicate. When you feel sick, when you start feeling symptoms of anything, go to the hospital and do a proper checkup. Self-medication is wrong.
Okay, Coach Didi, I like what you said. God help us. Doctor, I want to go straight up to the doctor to find out what are the risks involved in taking, chances in your hand. The doctor, if you can listen, if you're hearing us.
Elizabeth, could you retag that question again, please?
Oh, okay, I want to know what are the risks involved in us doing self-medication.
Okay. Now I get you clear, loud and clear. Number one, let me state the fact that amongst the discussants, most of you have come out to confess that you have been engaged in self-medication. And some even called for the fact that maybe moving forward, they're going to change, the trajectory. So let's go straight to the questions on the risk of self-medication. But before I even talk about the risk, let me also help us understand very clearly what self-medication means. You say self-medication is when you as a person on your own or an individual decide to take some form of, medication. This can be prescription drugs. This can be even supplements. And I'm going to introduce you to another aspect which you may have not think about. Taking some of these substances, things like alcohol, things like, cigarettes, they are all considered as self-medication. And these days, we've come to the, era of, internet. Some of us will get self-medicated on our internet due to the fact that, maybe you are stressed, so you think that when you engage yourself on the internet, watching this, watching that, will solve your problem. But in the actual sense, it doesn't. Maybe you spend too much time, and that also has some health impact on you. Now, the risk. Well, there are quite a number of, risks. First of all, having known what self-medication is now, clearly that you're taking it without a doctor's, prescription or a health professional's, guide, you are on your own. When you do that, the number one thing is not likely, in most instances, to misdiagnose your condition. You don't really know what is your problem or the cause of the problem, and you've gone ahead, you're taking medication. Let's take, for example, the case of, pain, where every pain you want to hit it with, Panadol or Tylenol or any of this. But I tell you one thing, in integrative medicine, what we know and believe is that pain is just a sign or a symptom that something is wrong. And this is the need, or this is the reason why, if you feel in pain, don't just start, knocking it off with those pain relievers or this. It may be a greater problem than you're thinking, and that pain that you are just experiencing. Just like, a car, once something starts going wrong, you look at the dashboard, you see red light. I would say engine oil, do this, or brakes, or this. The same thing our body does. When there is something wrong, or at the beginning of the process of, a pathological process, you start experiencing the pain. So it is better you go to a professional or a doctor so that he knows the root cause of that, pain. Another risk factor is that apart from misdiagnosis, you will also run into the problem of addiction. You also run into the problem of resistance. In case of, antibiotics, you are taking them indiscriminately. And let me tell you one thing, I've been fortunate enough to have been involved in, drug development process. When drugs are developed, it used to be over 15 years before you finally, now I'm talking drugs. Maybe after this, we can discuss even supplements and then some of the other habits like tobacco and then alcohol that are listed. So, you have to take the correct dosage. So if you are just self-medicating, if you're not trained health professional, you may not or you don't know the right dose to actually to administrate what we call effective dose. Because when you look at the process of drug development, a lot is taken into into consideration. The whole goal of you taking a drug is that it will reach what we call an effective, plasma concentration. That is, it will get to the target point and exert the effect that it was designed for. So if you're not taking the right dose, first of all, that effective plasma concentration will not be attained. So in other words, you just almost pay your money. You continue taking this thing and you don't see, the benefit. Another thing is that I've also mentioned the issue of antibiotics, resistance. That has become a great problem in our society. I think one of the participants even mentioned a case where people take antibiotics to clear themselves. But I'm glad at the end she cautioned that it is not right and it is appropriate that you get to the doctor who will determine the right dose. And when we talk about right dose, that's why when you go to, the doctor will write a prescription depending on the drug. They will take it, either tell you to take it 2 times, in a day, or 3 times in a day. They tell you to take it 30 minutes before eating anything. These things are all really important in establishing what we call the pharmacokinetics and pharmacodynamics of the drug. Simply put, the effectiveness where you will see, the benefit.
Thank you so much, Doctor. And a lot of people are actually writing. Yeah, I like this particular question. Should I take these questions now? Okay, let me just take this one. Somebody is asking, Doctor, you mentioned that alcohol and tobacco can also be wrongly taken. What is the correct dose for taking alcohol?
What a question. You see, in general, there's what we call biological variability. Individuals differ. Some will take 1 bottle of whatever, or just 1 sip of, hot drinks. They will tolerate it. But another, he will take just half of that. It will be destructive on this mental state and general, health. So in terms of recommendation, first of all, if you can, and it is recommended, medically, you don't engage in some of these habits that are detrimental or have the potential of causing health damage to your body. That is what I would say. So, but some are social drinkers. They can go 2-3 bottles, and then, but some, they cannot withstand. So again, I want to emphasize, number 1, there is biological variability and tolerance between the individuals. Then second, in general, I would advise that you don't indulge into those habits that are detrimental to your health, including alcohol and excessive, smoking.
Thank you very much, Doctor. I'm glad I've answered that question. All these other questions coming in, we'll take them as we go, but not exactly now. I noticed you were laughing so much.
Yeah, I was laughing because I wanted to ask him, what about excess food?
Excess food?
Yeah, because he did say that about, because there are certain things we take. Like me, I try not to eat after 7, because what did my doctor say, that the sugar level, because as you grow older, all your organs, they don't work as good as that. So if you eat that late, that means the sugar level, it wouldn't, your digestion system,
yes.
Yeah, there will be a problem with that. Well, with alcohol, I don't do alcohol, so I'm safe with that. I don't smoke. But I just realized that I hear different things like, oh, red wine is very good for the heart.
Really?
That's what you see, I don't drink, so I don't know, and when I see some people taking a lot of red wine, they said, no, that's what the doctor said.
That's not true.
I don't think any doctor said that, but that notion is everywhere.
It's everywhere.
But I don't think it came out of the doctor's mouth.
The excess you take, does it also account for your health? I mean, if you tell me maybe a tot or 2, it's okay. But when you do more than a tot, you do more than 1 bottle, more than 2 glasses.
No, but if you tell, you see, this is a problem. Knowledge is power. And I always tell people that we just, in Nigeria, I think we like to listen to side talks. Oh, if you do this way, it's going to work. If you do...
Not just side talks, the one that we enjoy, the one we want to...
So that's it. I tend not to take... When I was hitting 50, I used to do Well Woman. And I noticed I did Well Woman and some other things, and I got sick.
What is it?
No, Well Woman is just supplement.
But she didn't say that. I'm asking for the benefit of those
it was a supplement, and they said, oh, it gives you energy, it does this. So I now noticed that I never used to do supplements, but they said, as you get older, you should do that. So instead of me to go and ask my doctor what was good for my system, because A said it was good for her, I just went, I grabbed everything, A to Z. There's a drug called A to Z, Well Woman and all that, and I started taking it. And I started getting sick and sick. So I went to the doctor, and he looked at me and he laughed. He took me off so many drugs, from ibuprofen. The only thing I can take now for my system is paracetamol. I can't even do Panadol. So the thing here is that whether we like it or not, I think you should have a doctor that knows your history, because there are some times when you take some certain drugs, it triggers your system. Yes. So instead of making it better, it now makes you really sick.
Typically in Nigeria, we always ask people, that time that leg was paining you, what did you take?
Yeah, so that's it.
And then you say you took
yes.
Let me go and buy it.
Go and buy
How
it,
many
Prophet.
tablets did you take? At a go. And then I do. We like to, copy somebody. But the truth is, if you look at symptoms of ill health, it's always maybe body pain, a particular centralized pain, stomach ache or running, fever, headache, These things, meanwhile, there are 1,000 and million types of ill health that we have that has the same, or they all have the same kind of symptoms.
Similar symptoms, yeah.
So when we now see, okay, when I was having, it was just last week I knew the meaning of migraine. When somebody said I was having headache with eye, closing one side of the face, and that's migraine. I said, okay, me too. There was a time I used to have headache and my eye, one side would close. So that means I also have migraine. But I know that if I go and rest, such headaches will go away. But because my body is asking me to rest, meanwhile, I don't want to rest. I'd rather go to ask Devon, what did you take at the time when you had one eye headache? And she tells me my one eye headache may not even be migraine. It could be a symptom of maybe a growth in my brain. And it's good. I said I had a story to share, because when the doctor was talking, I remembered something that happened to me last year. I had a bit of challenge, health, and they gave me some drugs, and it was working. And they asked me to come in every week. Rather than go in every week, I went. The drug is very easy to. I'm not going to call the name of the drug so that our viewers will not get to buy it. I went on my own and bought drugs, because each time I had a challenge, I took the drug. I was fine. So rather than going back to see the doctor every week, I decided, okay, I could do every month.
Overdose.
So then on my own, I went to buy the drugs. Before I knew it, I had flakes and dry skin all over. Then, cranky fingers, you guys saw it. I'll pick something, my fingers will break. And I didn't know why, because I felt I was taking what the doctor was giving to me.
Do you want to clarify your fingers would break?
The nails, not nails, my skin. My skin,
so that people
yes. The fingers, the skin breaks up, and I get to see the flesh inside. It was like that. I couldn't hold anything. I couldn't do a whole lot of things because of it. I had to go back to the doctor, and he asked me, I spoke the truth. And he said, the one I gave you was just for a particular duration. And I check you and see your response, and I check the drug again and review. And when they reviewed, I got better. So the self-medication thing, it's serious. Now, to take care of that dry skin and with the brittle that come with it was now another problem entirely. So I had to go into another kind of medication to be able to take care of the flakes and dry skin and all of that. It was big. When I say everywhere, it was everywhere. I actually had to do a lot. Let's not go in details. But then I know that self-medication is something that we must never get involved in, because I've had my own particular experience. I don't know what you wanted to add to it.
No, to be honest, I was actually smiling. We're about to digress from this matter. When she said knowledge is power, I remembered Game of Thrones. When Littlefinger said knowledge is power, and Cersei Lannister said power is power.
But that said, as you were speaking, something came to my mind. I don't know if it's, and I know for a fact that Nigerians are extremely guilty of this. We go and sit in front of a doctor and lie. We lie. We withhold information. That's when we manage to go in front of a doctor. For the most part, you are embarrassed. Ladies particularly, there's a smell coming from someplace it shouldn't come from, or maybe there's some kind of gynecological stuff going on, and you are so, the thought of going to lie down and open your legs,
you're ashamed.
even if it's for a woman, you are ashamed, so there's shame. there's lying, there's withholding of information, and then at the end of the day, when the doctor doesn't have as much information as he or she needs to give us the right treatment, we go out there, the doctor is only working with what they know. That is why these tests are important. But then again, even, you know, people do these things sometimes because they assume what they don't say will be found in the test. No, it is based on what you are saying that the doctor will recommend a test. So that test is meant to confirm his suspicion. So if you don't give him all the information he needs, if you don't give him or her all the information they need, they may send you to go and do a test that will not show anything at all, because you did not give that doctor everything the doctor needed to put you on the right track. And then you go back home, that medication isn't working, and you think it's the doctor's fault. Not necessarily. You lied. You know,
or
so
actually you withheld information.
You lied, some straight up lie, withhold information and all of this. So I urge particularly women, no matter how embarrassed you are, because that issue is in with your private parts, something, just go see the doctor, tell the truth. What you did, what you didn't do, just tell the whole truth. Going to see a doctor is like going to see a priest for confession. Catholics will understand. Reveal everything. Don't be worried about what judgment is going to come from there. If you have a good doctor, they are not meant to be judgmental toward you. They are just meant to absorb the information.
People are scared of certain doctors because there's not much of a confidentiality in them. They actually tell your story to another person. And sometimes they call the names.
I've never encountered that. And if that is such a case,
so
I think such a person should be sacked.
People are ashamed to really open up with deep problems because they don't want the doctor to use them as a point of referral.
But that's simple. Now go to a hospital that they don't know you.
No, but the truth is, I don't know. Do you know of a person that this happens to, or it's just conjecture?
That's what
No,
they do it.
The doctors are human beings as well.
Doctors, and when they go to the
yes,
let's call
and call people's names.
They call people's names.
Kudos to my doctors. You guys are good. I've never gone anywhere and heard something private about my health.
Okay.
Never.
Let me bust your bubble, but you may not hear it too.
Yes.
Because simply because your doctor is talking about it.
So because
I'm not saying her doctors
as I haven't heard, I'm going to assume it hasn't happened, because if we push this narrative out there, it's going to escalate the problem. We are going to get more and more people refusing to open up and speak. And I feel as if even if this happens, it's not on a large scale to the point where people will be frightened of speaking the truth to their doctors. And if you hear that, you know, your personal issue is out there and you know probably that you discussed it only with your doctor, or the level of information that's out there could only have been passed around by your medical professional, then you can investigate further, and probably the doctor in the house can tell us what steps you can take to make sure that such a doctor is disciplined, because they are meant to take such information with them to the beyond. It's not their business to.
I wanted to.
We'll get to the doctor, but let's quickly take
I just wanted to talk about something that occurs in Nigeria. We just realize people are just dying. People are having what you call it, stroke and all that. I realized that many people don't even know they have high blood pressure. So many people don't even know they have low blood pressure. So the thing here is that one day you just see somebody has collapsed and died, somebody is having stroke, and it baffles me when I hear, I didn't know I had high blood pressure. So the thing here is that because you have high blood pressure, this other person has high blood pressure, they are taking the drug of A and B, forgetting that you have to go to the doctor. The doctor has to tell you which one suits your body. Then I realized that Nigerians again tend to take that drug and they take it for like 10 years, forgetting that there are sometimes after a while, this drug does not work on your system. It has to be reviewed and it has to be changed. So this is one particular thing I noticed. Everybody around is taking everybody's own high blood pressure drugs, And I think we have to talk more about it.
All right, so we'll take it to the doctor straight up to advise us. Beyond the high blood pressure drugs, doctor, we also notice that some people, when they want to read, their glasses are not available. They just ask their neighbor, I beg, borrow me your glass, make I just take read this book. I beg, does it have any side effects? Because that's also a form of self-medication. I can't see, and I borrow I own to see. What are we doing to ourselves with it?
Well, Elizabeth, thanks for that question. What I'm going to say is this. That is what, in integrative medicine, is what we call personalized treatment. That is to say, Elizabeth is different from Mrs. Hamacho. Your bodies are different. The way I would treat A or manage A for diabetes reversal or hypertension management is different. That's why you need that training and understanding to go carefully into an individual's personalized, treatment. As you rightly pointed out, the fact that A responds to a particular type of antihypertensive medication, B may not. And that's why when you go to your doctor and he treats you with one and you don't respond, this is just a general rule, you see that he will change to another drug. If you look at the mechanisms or the pathology or the pathophysiology of all these diseases are very different from an individual to individual to individual. Take for the case of diabetes. There is diabetes that would be as a result of insulin sufficiency. It means that the pancreas, that hormone, that organ that produces insulin, that regulates the level of blood in the body, is not producing enough. It could also be due to the fact that even if the pancreas is producing insulin enough, but when insulin goes to the cell, receptors, it is not able to play its own role of opening up the receptors so that the sugar will go in. So you look at what you call insulin sensitivity, and then you look at other factors when you are managing these patients. And drugs are designed and created for different mechanisms, and we don't want to go into details here, but the cause of your diabetes, for example, will respond to one diabetic drug better than another. But for me, let me sign off by also saying what you people captured ably. This is on ethical behaviors. Some of these things, they're not generalized. They cannot be taken as generalized statements. The fact that you have maybe one or two out of over 100,000 doctors divulge information, just like some of you cautioned, that should not be relayed to the public, so that it will create fears and insecurity into patients opening up. That's what I would say for now.
All right, doctor, just saying on you, I'd like to know if I find my medical practitioner, throwing around my story, can I sue him? Is there a possibility of litigation? Does the Nigerian Medical Association, have a law against this?
Well, you see, I'm not here to discuss, medical ethics. But in general, as a trained medical doctor or professional, even nurses, you have what we call guidelines, behavioral guidelines, ethical guidelines. And if you go against these guidelines, including, privacy, there are some punitive measures that will be taken, to forestall and prevent any of such, behaviors. So first of all, in our practice, what we do, I don't call the guy that comes to us as, patients. I tell them that we are partners. We're really working towards, restoring, your health. So it's really very nice that you open up with me, with us. We'll go into details of establishing that synergistic and then coherent, relationship. If you feel free, even Abinocho, when a health professional is taking steps that you are not comfortable, you can freely voice out that. And a good health professional, he knows his or her own, limits, not just to expose you anyhow in case of maybe they are doing a particular procedure with any of your private parts. That is really
all right, Doctor, I'm still going to be on you. Some people are asking questions. I want you to take it directly. This person says, please, doctor, can a doctor who is also a parent give their children drugs at home without going to the children doctor in the hospital? And at the same time, is taking antibiotics when one is injured considered as self-medication? You didn't write your name here, but I can't call your name. But doctor, that's the question. Can a doctor treat his own child? That's what he's asking.
Well, in general, medicine looks at it this way. You are advised not to handle your own blood, relation. It is better for another doctor to do that. This is to avoid, any bias and any emotional. But this is not to say that you are with your son and he needs, immediate intervention. You will hold onto that. Then the question of antibiotics, we have discussed this at the beginning of this, expose, that self-medication, particularly of antibiotics, will lead to issues of resistance because you are not a trained health personnel. You don't know the right dose. And then there is what we call drug-drug interaction. You don't know which of these medications, if given concurrently with others, will lead to interaction. So all these things, you must be guided by a doctor who is well trained. He knows how much, he knows about the dosage. He knows about the drug-drug, interaction, if there is a potential for any of such problem to be, developed. So it is really very, very important, and we cannot overemphasize the fact that do not engage in self-medication because of the known side effect or risk that will come with it.
All right. We have questions and contributions coming from different people, particularly like this one, Charity from Benin. Charity says, good morning, amazing women and doctor. Mrs. Joy, my personal person, how are you doing today? Yeah, you know the person. And he says, every Nigerian is guilty of today's topic, and some of our doctors are not also helping us. Let me share my experience. My baby was running temperature, and I called my doctor, and the first thing he told me was to treat malaria, that the baby is having malaria. He gave me the names of drugs to buy. Eventually, when I told him that I was seeing 2 teeth coming out, he was like, oh, it's teething. Don't buy those drugs again. You can imagine, all right? That's not very good. Thank you very much for sharing this. I think for children specifically, we must ensure that we take them to hospitals. Another person says, yeah, women advocacy on self-medication. Oh, okay. That's all you wrote, Chief Bayo. You didn't add extra, right? We're not advocating for self-medication. We're actually saying no to it. Your conversation is apt and timely. The cost of medication in Nigeria is the precipitate to self-medication. How do access to health to reduce this dangerous phenomenon? Tom Egbele from Jos. Thank you, Tom. I hope we're doing good with our answers, especially contributions from the doctor. My name is Mrs. Gift from from New Nyanya. My problem here is these malaria issues every time. Mine is just 3 years old, son, and only this year we have treated malaria 4 times and typhoid twice in the hospital with drugs and injections under 3 months. And now he is having catarrh and a little increase in temperature. We took him to the hospital and did complete check and blood tests. The hospital is still saying malaria. I don't understand though. She added, oh, is it possible for someone to treat malaria more than 4 times in 3 months? Please, what should I do? All right, this question is not for Elizabeth, it's for doctor. So,
Before even the professional chips in,
okay.
I'm sorry. I have to, because I'm somebody who has spent time in hospital as a patient from childhood till now. So the thing is this. I think that resistance is not only with antibiotics. Of course, if I'm wrong, the doctor will correct me. Misuse and all of these things can cause issues. But apart from that, you see that I formed a habit of reading that small paper that's inside,
Yes.
whether it's prescribed or whether
That's
I
my
went and
mom.
bought it myself.
Yes.
I read that
it.
paper
We don't
because
read.
I'm trying to figure out, yes, they will write, 2 times daily, the doctor will write all of that. But they don't tell you what you should not do or eat when you're taking this medication and so on. So I go the extra mile to read that piece of paper.
Yeah.
Sometimes they'll say, take like don't take fatty meals with this one.
Don't take citrus.
Don't take fruit.
Yes.
Don't all of
What's the
this.
citrus?
I found that from the inner pamphlet, which nobody ever reads.
Yeah.
So I also find that there is a recommended temperature at which we are meant to store medication, which even in pharmacies, especially in areas that are very humid and hot and lack adequate electricity. Abuja, we are lucky because most pharmacies are standard. I think there's a professional body that goes around checking and things like that. But when you visit outside the city center, some of these semi-rural places, you enter a pharmacy and it is hot, really, really hot. And yet there's a temperature that has been indicated on the pack at which that medication should be stored. So I think that in some instances, it may be possible that improper storage, and then there are people that will buy medication and leave it in the car.
Yes.
And you have leather seats.
And heat.
You know, it's like putting that medication in the oven.
Yeah.
You know, but later you come back and you take it and all this, and it's not working.
It's not.
So I feel as if there are so many things that factor into whether a medication will work for you or not, that we don't necessarily abide by. So it's possible that this lady actually is living in a mosquito-infested place, in which case children are fragile. They'll succumb to malaria more than adults. That's my thinking. It is also possible that lack of proper storage of the medication, either from where she bought it, even in the house. As a result, it is not working as effectively as it should in the child. So it keeps recurring. But these are just my thoughts as a lay person. So I'm going to leave it now for the doctor to say where I'm wrong.
Even before the doctor comes in, I noticed something. At a point, I used to treat malaria, every month or maximum every other month. And I didn't know why. I checked my environment. I didn't have much of exposure, except if I go out in the night, I get bitten. But then it took a doctor, you won't believe it, was actually a student doctor who spoke to me in a big hospital. And she said, when they tell you, take your first dose now, and the next one is 8 hours, and the next one is 12 hours, madam, please follow it.
Follow it.
Because what we do is you take the first one,
Yeah.
usually the backup singer, like I call it, which is 8 hours, I would do the 8 hours. But the other one that is 12 hours after, another 12 hours after,
Yes.
what we do is when you wake up in the
get
morning,
well.
if you wake up today by 7, you take it by 7.
Yes.
By night time, you probably will take it when you're going to bed.
Yes.
Which could be 10, it could be 11, and as long as you know you've done morning and night. They say strictly 12 hours. That's why sometimes they'll tell you to sit in the hospital. And then the lady also told me, the lady doctor told me, I should not take my malaria pills with certain kinds of fruits.
I just came to know that
You
last
know?
year.
Okay, I shouldn't take it.
Citrus.
Because when you do that, it actually breaks this double combination we're doing. It breaks the efficacy. So, and I follow this strictly. I had to put a timer on my phone to remind me to take the drugs. And seriously, I could stay off malaria for 3 months. Unlike going to hospital for treatment every month or sometimes even twice a month. But let's get it back to doctor. Doctor, self-medication, is beyond just buying drugs and taking. The prescribed drugs, prescribed by doctors like we were talking about, but we go back to our houses and we seem to be falling back into the same problem. And we've all tried to say our own bits here. Let's get it back to your table to clear up.
Yeah, Elizabeth, I think you said it all when you were talking about, the timing of, taking, drugs. Pharmacologically, drugs are formulated simply by converting them from one form to one active group, what we call an active group. This can be a hydroxyl group or carboxylic group, blah, blah, blah. That is why when they go into the body, drugs have to be biotransformed, again, to a group that will be active. Let's not go into those details. But the key point I want to drive home here is that each of these drugs, they have the storage, conditions, just like Devon said rightly. They also have what we call half-life. Take, for example, the case of metformin, and I'm not discussing prescription here, so let me make that clear. You see, the standard practice was you take 2 times a day, but now we've come to know that the half-life of metformin is 8 hours. I happen to be privileged to have a senior brother who is an endocrinologist, and we were discussing, because he was the one that told me this recently, that look, all his patients that he used to give metformin maybe 2 times in the day, he now reversed them to 3 times in a day, with the fact that the half-life, that means the time which it takes for a drug to be active. After that, it will no longer be active. It's 8 hours. So if the half-life of metformin, as an example, is 8 hours, you see it bears reasons that metformin should be taken 3 times. And here again, I'm not making prescription. I'm just educating the public on what we've come to know. So the other point which you say that it is also very important, yes, when they tell you to take this drug 3 times a day, that's why you see when patients are in the hospital, you see the nurses are very timely on when they give this drug. As you rightly said, take for example, if you give metformin 8 hours, then you're supposed to give another one 8 hours. You don't give, then you're given after 12 hours. There is a relapse. And this is why they tell you, take this much and take it at this timely interval. It is really very important. Another thing we really need to know, just like Devon said, when you get medications, it's very important for you to study that leaflet, because the leaflet is carefully put together to really guide you, especially on storage conditions. If some drugs are known to be what they call thermolabile, that is to say that the temperature will destroy that active component that will be useful to your body. If it is said the storage condition is 4 hours, you keep on going. I mean, you're taking something that is ineffective to your body. So let's stop at
all right, thank you so much, Doctor. Our time is no longer ours. But then, quickly, a lot of people are asking me some drugs that we can take without prescription. Ehi, are you there? Can you just play that little clip for us? at least we know a bit of the drugs we can take without doctor's prescription. That's where we wrap up for today. Thank you all for coming on the show. Happy birthday again. Can we say our bye-byes? Bye.
Bye.
All right.
Let me talk of experience.
I love this. Thank you.